If you are someone who's suffering from hand pain or numbness that's driving you absolutely crazy, don't wait anymore. My name is Huang with Hands-On Therapy Services. Let me help you understand a little bit more about what's going on so you can know that it's possible. Then you get the right kind of help so you can avoid injections and avoid surgeries and stuff like that, and actually just be able to fix it. Right? So when it comes to nerves, I drew this picture, and you can check out one of my other videos when I was talking about what could potentially be going on, because really at the end of the day, when your hands are hurting and they're numb, it makes a big difference in terms of where it's numb, okay, and how it's numb and when it's numb. Those are all really key things, like that when you go to an occupational therapist or someone who's a certified hand therapist, they can help you really figure out what's going on in terms of those types of questions. And it's really important to find out not just, you know, when and how often and that kind of stuff, what day of the time. It's really important to find out where it is. So, but you can be stuck in several different parts of your arm, like so your elbow, your shoulder, and of course your neck, right? So we have three main nerves that come out of our neck, pass through our shoulder, down our elbow, and into our hands. And a lot of times it really takes figuring out where it's stuck. A lot of times people come to me and they say, I've gone to my doctor, I've done nerve conduction tests, and those are great because we've been conditioned our whole lives to go to doctors. If you want to go to a doctor, I encourage you to go to a doctor. We can direct you to which doctors or kind of doctors, the type of doctor to go to, essentially, that could give you some more insight if that's the way you want to go. But nerves can get stuck. And if you're looking to like avoid going and getting these nerve conduction tests that might not always tell you exactly what is wrong, where it's wrong, but they don't tell you how to fix those problems, right? And so a lot of times it's either do you have surgery or do you don't have surgery. If you're someone who you've got pain and you've got numbness and you're like, I want to try to avoid surgery, you've come to the right place. My name is Huang at Hands-On Therapy Services, and our specialists will help you figure out where the problem is. Just because you have surgery on your hand, but your problem is actually your elbow, your shoulder, or your neck, all that stuff is going to come back and it's going to bother you at some point later, right? So in the last video, I talked about radial nerve. So if you have radial nerve problem, you're going to tend to feel, you have three main nerves, right? Three main nerves. So I'm going to go over really quickly. Most of the time people know carpal tunnel, right? Carpal tunnel. And that's one nerve. Most people might know cubital tunnel. Cubital tunnel. All these tunnels, right? And that is going to be a very particular nerve, and that tends to happen in the elbow, right? So I'm gonna actually talk more about that one today. The other one that I'll tell you about, the other one I'll tell you about is the radial tunnel. And that is the less known, most problematic, not one that you would tend to do surgery and you won't really find it on nerve conduction tests. But let's talk about cubital tunnel. It has to do with the ulnar nerve, right? I know that a lot of people, when they have nerve problems, they start looking stuff up online. So I just want to give that to you. So if you wanted to look it up online, you can. So that nerve passes through your elbow, and what it does is it affects your small finger, right? It makes your small finger go numb, and that nerve goes to half of your ring finger, so you might feel it numb on only one half. But if you touch it on the sides like that, you might feel a difference. If it's really bad, that's when you feel a difference. But let's not wait until it gets so terrible, because what you're gonna find online is that you wear something at night which is so uncomfortable, or you have surgery. But I have been able to help people with this type of problem. If you come in early enough, right? Even mild to moderate problems, if you come in early enough, we can help you get rid of this type of problem so you can avoid surgery. And I've had patients that have had this surgery and they're super active people, and what happens is it starts to happen again, right? And if you go to the doctor and it happens again, they're pretty much going to tell you the same thing. We can splint you again, or we can do another surgery. If you are someone who's looking to avoid surgery, then it's really important to find out. So this is an elbow. It tends to be stuck at the elbow. Oh, what happened to my markers? It tends to be stuck in the elbow. But what we want to know is it just the elbow, or could it be at the shoulder level, or could it be at the neck level? So it's totally possible to figure out where it's coming from, so you can get really clear in terms of how to fix it. Now, a lot of times it's going to be on this side, and if you are, feeling numb, one of the things that you can test yourself. Even if you bend it like this and you wait for a minute and you go numb, then I had this actual problem when I was pregnant, and I would talk on the phone, and by keeping it numb like this, it would really, really irritate it. So one thing is not to keep your elbow bent. So you gotta look at what you're doing during the day that keeps your elbow bent like that. And the other thing is, if you're sleeping, you tend to be a back sleeper, and you're putting pressure right on this nerve. That nerve is the most superficial nerve, meaning that's the funny bone. Like, you can hit it really easy. When you hit it and you feel that tingling, like electricity shooting pain sensation, that's that nerve right there. It's not a fun experience. So imagine if it's getting squished and compressed in there constantly, then that's the sensation you're having. So if you're doing anything where you're putting a lot of pressure on that area, that might be what's causing some of that numbness too. So those are two things that you could try and modify so that you don't do it. But if you're like done modifying, you're like, I don't want to not do this my whole life, I want to actually get rid of it, then come give us a call here at Hands On Therapy Services so we can help you figure out what's going on. Is it at the elbow only, or is it at the shoulder or at the neck? And then we can, your body is developed in layers. You have skin, fascia, muscles, and it's really important to figure out where you are stuck so you can actually fix it and get rid of the problem for good, so that anytime it starts to bother you again, you know exactly what to do. All right, so if you are having some numbness on the small finger and half of your ring finger, you may have this, but I don't want to guess. And I don't want you to guess either. So if you want to get some real help, get clear in terms of what's wrong so you can get the right kind of help, then give us a call here at Hands On Therapy Services. I'm going to include the links below so that if you have questions before, let us answer them. My name is Huang, and if you like videos like this, then just hit the subscribe button and I will be putting out more videos for you. All right, I'll see you on the next one.